Hi, everybody, and sorry for tonight's delay. We're having some technical issues, but hopefully the delay is worth the wait. And you're going to be joined tonight by Dr. Louise McBride, Head of Department of Nursing and Healthcare. And we're also going to be joined by Stephanie Boner, Lecturer in Intellectual Disability Nursing, and going to be joined by Kieran Murray, former student at LYIT and graduate in Intellectual Disability Nursing at LYIT. So let's get started. We're going to be joined now by Dr. Louise McBride. So Louise, you're very welcome.
Good evening, Fiona. Thanks very much for the invitation this evening.
And thanks so much for joining us in the delay in the background. So the joys of technical aspects of these things, but it's great to have you. And tonight we're going to focus, Louise, on the CAO programs. We're going to start tonight with the general nursing degree. It's a 4-year honours degree, level 8 in general nursing. So for those watching tonight, can you tell us a little bit about general nursing at Letterkenny IT?
Okay, so just to say, it is a 4-year full-time honours degree, and general nursing, I suppose, is specifically focused around somebody who wants to come into the caring profession, and you predominantly work in the acute hospital, but obviously you also work in the community, public health nurse, and you specialise then in different areas as in the course of your placements in medical, surgical, orthopedics, oncology. So there's an array of different placements as part of the 4-year course, which sort of honours the requirement by the Nursing and Midwifery Board, which professionally regulates this programme.
And then in terms of points for the programme or entry requirements, a normal, I suppose, standard Leaving Cert student coming in from the Leaving Cert, and in the last 2 years, the points have been in around that 395, 410, haven't they, for general nursing?
Yes, Fiona, and there's excellent overview of the points on page 190 to 195 with regards to our points.
Mhm.
So it's a really good guide for anybody who's looking at nursing, one of the 3 programs that we actually deliver. So just to say and to flag, I suppose it's important to note that there's special requirements with regards to nursing, like prerequisites. So your maths, you have to have a 0, ordinary level 6 or a H7. You need to have a science subject, Fiona. So you need to have your physics, your chemistry, your biology, or the combined one. And also ag science is regarded as a science subject. So as I've said, the clear guidelines with regards to the minimum requirements are there, but you need to have your maths, which is very important, and you need to have your minimum of 606s and a higher H7s and at least 2 H5s. That sounds very technical. So for anybody
Yeah.
that's, calculating up, the points are actually there. And as you've noted, Fiona, in the last couple of years, particularly with the onset of the pandemic and the predictable grades with the Leaving Cert, we
Mhm.
have noticed an increase in the points there. So
Yeah.
I'd like to reassure everybody, certainly since the Minister has announced that there is going to be a Leaving Cert, as we all know, in June, but there's
Mhm.
going to be a wider scope for students. So not to panic, and just to, to focus and to make sure that they have got the prerequisites like the
Yeah.
maths and the science subject, and just do their best in getting the points.
And the one thing I suppose I want to highlight tonight, that it's not just the Leaving Cert student that would go towards nursing. There are other routes and pathways. So we would have mature students, and we would also
Mhm.
then have students who do PLC programs. So generally speaking, would be the PLC in nursing studies. Isn't that correct?
That's right, yeah. So it would be a level 5 further education course, and we have 3 places each year that are offered to further education level 5 applicants. There are 5 places for mature applicants, which is a different entry system. Again, very important to actually look up the entry system because it's a little bit different to obviously Leaving Cert and further education. And we also in the last 2 years have offered a place for here and also for there. And that's the same across our 3 programs, including psychiatric nursing and intellectual disability. So it's important that those in further education mature and here and there also have access routes onto our nursing programs.
And now, for anybody that's watching tonight that is a mature student and has only, I suppose, the mature student route, know that it's too late for September now coming in. So you just
Yeah,
missed that 1st of February deadline for
that's
if it's
right. Yeah.
mature only.
If it's mature only, you've missed the deadline. And really, for those that are interested in that route, now is the time for thinking for it next year, obviously, because those that have applied have already followed the system. And I just want to draw your attention to the mature route and that whole process. There's an excellent resource on the Nursing and Midwifery Board website. It's Nursing a Career for You, and there's an orange booklet that they can download, or we have some. I just put a bundle of them down there at the front door. So if they know anybody in the college and say, will you get me one of these and take them home, or we're happy to send them out to a career teacher or a bundle to any school that might like to have them also.
I suppose a question has come in from Tanya. She's asked, I suppose, what are the contact hours for nursing students in terms of class time?
Yeah, so our first years come in September, and they're in for 6 weeks, and they've a heavy timetable. So they'll be in for 4 full days: Monday, Tuesday, Wednesday, Thursday, and a half day on Friday. And it's predominantly the same for first year for the 6 weeks in the winter semester and the spring semester. And then once they finish those 6 weeks of class, they go out in placement, and their placement will be a 35-hour week also. So it's a heavy timetable. It's there's quite a combination of core and also specialist modules. So we hit the ground running with regards to actually immersing them in the fundamentals of nursing, in the different modules, be they core or generic to all disciplines, or specific or specialized. And they also get exposure then in our labs, in our simulation labs, for certain skills and practical. So it's a good hands-on course also.
Okay, and Louise, you're talking there about facilities, and our on-site hospital is just, I suppose, clinical studies area is awesome, and the number of people that come through our doors and see the facilities are blown away.
hmm Absolutely. We've state-of-the-art facilities. We're very, very lucky, very fortunate. It simulates our labs simulate the clinical environment. So it's like a full ward up there on the third floor. Our transition students and students that visit absolutely love it. So you've your drugs trolley, you've IV fluids, oxygen. So it's very much a safe environment for them to practice skills and different interventions for the acute patient, be it in general nursing, or maybe interviews or role playing with psychiatry, or different techniques and interventions, be it a client with a challenging need, or an intellectual disability. So yeah, we've fabulous facilities, and we pride ourselves in them. We've also invested in quite a lot of simulation equipment, and we're embracing the whole virtual world. So we're looking at virtual learning headsets so that they can actually see that virtual learning environment. So we've invested heavily since the pandemic so that we can actually maximize learning on several different levels.
And then in terms of, I suppose, careers, for a general nurse, where would general nurses tend to, I suppose, go, or what direction would general nursing take you?
Well, as you said, it's a 4-year full-time course, so we advise any of our graduates to get post-reg experience in the relevant discipline first, and that settles them down after their internship, which is a long internship of 36 weeks in the last semester of their 4th year. So predominantly our graduates would take a couple of routes. So many of them will stay in the clinical area, obviously, and might decide, really, I like to specialise in palliative care, or I'd like to specialise in emergency nursing. So that clinical specialist route is available to them. So we offer some courses that actually will contribute to that: emergency nursing, acute medicine. Other graduates, after some post-reg experience, they might decide to go down the management route. So they might apply to be a clinical nurse manager. So there's obviously opportunity for promotion in nursing, but that would be a couple of years, 2, 3, 4 years after you actually graduate. But there's also the route of education or research. So it offers up obviously an array of different pathways once they qualify. And then we find quite a lot of our graduates, after they do postgrad courses, they might decide to do a master's also. So I suppose it's that clinical specialist route, the management route, or the education and research, which offers great variety for anybody who might
Yeah.
graduate in the area of nursing.
I suppose it's very multifaceted in terms of career opportunities from the general nursing program. And for anybody watching and they want to know the code for the CAO is LY908 for general nursing. That's a BSc honours in general nursing. And remember, if you're using just a mature student entry route only, that has already closed as of the 1st of February. But the PLC route applications and for the Leave and Search students can still apply now on the CAO as a late applicant up until the 1st of May. We're going to change tack now. We're going to move towards the other area of nursing, which is psychiatric nursing. And this program is CAO code LY918. So, Louise, could you tell me a bit about psychiatric nursing at Letterkenny IT?
Okay, so psychiatric nursing is, I suppose, it's important to note that the three courses have quite a lot of common modules or shared modules across the strands of the program. But psychiatric nursing is obviously very different because you're looking after vulnerable adults, adolescents, with who have actually got a mental health or a psychiatric condition. So that might be in the acute or even in the recovery area. So whilst it's very different to the acute of general nursing, it is obviously the caring profession and very popular a choice also, offering an array of different opportunities for our graduates.
And again, there are places available for PLC students and also mature students.
Absolutely. So we have typically 32 places in this course, and 5 of those are mature, 3 are for further education, 1 here and 1 there. It is important to note about our psychiatric program, we straddle 2 different mental health services here in Donegal. So half of our group of 32 will be assigned to the Donegal mental health services, and they will do their full 4 years of their clinical placements in Donegal mental health services, whereas the other half, Fiona, will actually complete their placements in Sligo Leitrim. They get the same experience. They have to do the
Mhm.
same hours and that, but it's obviously in the different services. We used to have them going across all with Donegal, Sligo, Leitrim, but we found from feedback from students and for continuity that it was best that they're aligned to one of those services for the 4 years. So that's an important piece just to note. If you're applying, you apply for psychiatric nursing here at Letterkenny Institute of Technology, but once you start, then we assign half of the class to one or the other of the services, and that is by random selection, unfortunately.
Okay.
So, yeah.
Yeah. So in terms of, I suppose, placements, there is a placements officer though at Letterkenny IT that works with the hospitals and those areas to secure placements, so students don't have to do that themselves.
Absolutely, yeah. We have full-time nursing allocations office here at Letterkenny Institute. Placements are all organised. We have student allocation liaison officers connected with our HSE partners. So all of those things are sorted
Mhm.
out. And we're very accommodating. Obviously, if somebody is from Donegal and there's a placement and there's issues around travel, we negotiate and we look at how we can facilitate students, pending on different circumstances. Because as we know, different circumstances will arise for different students pending on their journey with us for the 4 years.
Yeah. And as a psychiatric nurse, you too will be spending time in that clinical studies area. You'll be at the cusp of the latest technologies that exist at LYIT, and you'll be immersed in, I suppose, that balance of being on campus and doing your block delivery on campus, and then out on placements. Placement forms a big part, as you mentioned.
That's right. Our practice placements is integral to the program. So without
Mhm.
the practice placements, students wouldn't actually be able to fulfill the requirements by the Nursing and Midwifery Board. It's important also to note that we require special conditions or special entry around all of our programs, which would include a health declaration, Garda vetting, and also they have to do mandatory training so that they're prepared before they go out on placement for the actual clinical placements that they'll do throughout the 4 years. So, it's absolutely integral, and students love going on placement because
Mhm.
being in class and being in the labs is only just one side of it, but they get the opportunity to apply the theory and to do what they've done in a lab in the real world. But it's that safety net before they actually go out in the area. So any students that aren't sure after the first couple of weeks, once they get out in the placement, say, yeah, this is it, this is what I've signed up to do. So placement's so important, so
Yeah.
very, very valued for them.
And the placements for general nursing and for psychiatric nursing, that last placement is paid.
Yes, that's the great
Yeah.
news. So they have actually in year 4, in their final year, from January right through until the end of August, there is an 8-month internship. So you're a contracted employee by the HSC, whether it's in the acute hospital or whether it's Donegal or Sligo Mental Health Service, or indeed Donegal Intellectual Disability.
Mhm.
So they're salaried for a duration which is a percentage of a first year staff salary. So they will do night duty, they will work weekends, they get full exposure of what it will be like a real graduate or a registered nurse. And that really prepares them for being a graduate registered nurse. So they have that with, whilst they are, you know, competent and they're, you know, they're able to work on, you know, they're autonomous, they're not fully registered, so they're still
Mhm.
under the sort of the direct guidance of the qualified staff. So that's a really good aspect of the 4-year degree, that internship that really gets them ready once they qualify then in the autumn of their 4th year.
Yeah. And psychiatric nursing careers, what are the graduate opportunities from psychiatric nursing, Louise?
Okay, so most of our graduates in psychiatry will potentially stay in the acute services. Some of them go to the community mental health. There's quite a lot of different postgraduate courses that they can specialise, CBT, counselling, addiction. So there's an array, forensics. You know, we have a placement where some of our students actually go to the Central Mental Health, the Central Mental Hospital in Dublin. So there's an array of different opportunities, and we find that it's only when students go through the 4 years that they get sort of you know, a draw for a particular area, and they say, yeah, that's the area I want to specialize in. So that exposure over the 4 years really firms up the area that they might decide to actually work in. And I think it's fair to say that, you know, for every graduate nurse in the last couple of years, they have had so many opportunities for jobs. Lots
Yeah.
of our students go to Dublin, they go to the UK, Australia, America. So there's huge opportunities for those, particularly if they want to travel or work in other areas. But predominantly it's the acute, the community, or working in you know, the community mental health services. And that has changed, and certainly the reconfiguration since the vision for change in terms of mental health services and delivery.
Fantastic. And just, I suppose, on a celebratory note, we're celebrating an anniversary next month, or is it this year? Is it March coming?
Yeah, yeah, we're celebrating 20 years of delivering nursing at Letterkenny Institute of
Wow.
Technology. So it's amazing that it's 20 years, 50 years of LYIT, and now 20 years of nursing. So it's a very important year, and it's on the
Mhm.
cusp of us joining ATU, a university. So yeah, lots to be celebrated, and we'll be having some events here on campus with our students and our staff and our past graduates to mark the event. So it's an exciting semester indeed for us all, Fiona.
Yeah, for sure. Well, I'm going to give you a break now, Louise, and we're going to be joined by lecturer in intellectual disability nursing, Stephanie Boner. And Stephanie, you're so welcome to tonight's session. You are going to talk to us about all things intellectual disability nursing. And I suppose a question that's asked a lot of me, Stephanie, is what is intellectual disability nursing?
Well, I suppose it's very different type of nursing than general and mental health, Fiona, because and a lot of people don't actually know even when they come into the program what's it about. And I suppose a person with an intellectual disability, there's something there, maybe that there's damage done to a person's brain, and because of that, our brain controls everything in our body and all our functions in our body. So because of that, they're not able to do everything the same way as what we can do. So like, our brain controls our speech or eyesight. So some people may have difficulties with speech and talking. They may have difficulties with vision and seeing. They may have impaired vision, but it also affects sometimes our movement. And like we may have, some people who have a difficulty, they mightn't be able to walk the same way as we have, or they mightn't be able to, to be as independent as what we are able to do, and to function socially maybe the same way as what we are. You have there's various different ranges of it, Fiona. You have what's called, we vary it from mild right up to severe, profound. So somebody who is like with a mild intellectual disability are people who you may see out in the shops every day. They have jobs, they're working, they're employed. They're the same, people with an ID are the same as you and me. They're not sick, they're the same as us. And they have the same rights and same responsibilities and same way, they should be treated with dignity and respect, the same as everybody else. But at one end of the scale, then that is the mild, but you have somebody then maybe who's at the opposite end, who'd be more profound or severe intellectual disability, and that might be somebody who is more dependent. They need help with maybe nearly all of their activities, as we call, of daily living. So, they may not be able to talk, they may not see, they may need help, getting fed, getting dressed. All the kind of the basic kind of nursing skills are things that we would need to do. So in intellectual disability, you can't just say intellectual disability because it's so broad. You have people who are very, very mild and very, 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 very mild, that sometimes you mightn't even notice that they've got an intellectual disability. And you have some people at the opposite end that are more severe and profound and need an awful lot of support and help. And then obviously you have all in between as well, a wide different range.
So it too is a 4-year level 8 honours degree programme, accepts people coming in through PLC and the mature student route, as well as, I suppose, that normal standard leaving certificate entry by the CAO. But I suppose modules wise, would it be similar in terms of the modules that you'll cover with general and psychiatric, or what makes this programme unique in terms of the delivery?
Yeah, I suppose in first year it's more like a common sort of a core, and you're taught along with the general and with the mental health group of students as well. And a lot of the skills, like obviously we have to do certain skills, so they'll have to do their skills the same as everybody else, and they utilise those clinical skills labs that you talked about. We do like your temperature, your pulse, your blood pressure, your blood sugars, your injections, all of those. But one big area that we would focus on would be, and Louise alluded to it earlier, would be communication and communication skills. We need people that you're communicating with an intellectual disability don't have maybe the verbal communication. So we would have to focus an awful lot on helping them to develop their communication. And, they use like alternative methods, like they'd have PECS boards, and they would use sign language. So there's a big focus in relation to that on our programme. As well, they obviously have to do everything the same as what the other students do in terms of like anatomy and physiology, in terms of research, because our nursing interventions that we perform for people with an intellectual disability as well, everything we do has to be backed up with evidence. So there's a big strand of research running throughout the programme. But obviously for ID, it would be more focused on the things that are happening in practice, and you're taking like the nursing interventions that we're using from practice. We have a big focus on person-centered care, that the person with an intellectual disability is kind of at the center of everything we do. And, we'd have to, what we look at is we look at their abilities and not their disabilities. You see the person first, and that's one of the key things we try to get across to students. And that's for all disabilities, not just intellectual disability, but you try to see a person first and then their disability second. And what you try to do is look at what they can do, not what they can't do, but what they can do, and then look at what are their needs. And what we try to do then is develop things like social skills training programs, self-help skills training, so that you're getting them to develop to their full potential and to be as independent as they can be. They're maybe, they'll reach different milestones at different times. They mightn't be going at the same pace as we're going at, but they will reach those milestones with the additional help. And that's kind of what we focus on.
I suppose all aspects of nursing require compassion and a certain set of, like, I suppose, soft skills. But there's something particularly, I suppose, compassionate and requires a certain level of empathy when you're going into the area of ID nursing. So, like, who would be attracted to this program? Would it be somebody who maybe is coming from a background of caring, maybe coming down the PLC route, who've maybe had done a course, like, for instance, in healthcare support, or what kind of learners does the program attract?
Well, I suppose, Fiona, over the past few years, we have people coming in who have no knowledge of intellectual disability, and they end up loving it. They get to know the program, they've no experience, because there's that lack of knowledge out in the community
Mm,
about what intellectual disability is, and people mix it up with mental health. So you have people coming in who maybe come in and they want general, or they want mental health, but they end up they get intellectual disability, and some of those people don't want to leave the program, so
mhm,
they stay. So you have people who might know that they're suited, so you have those people who might apply, but anybody really who's interested in a caring profession,
yeah.
and anybody who's interested in working with people with disabilities. And we have a variety of different settings that you can work with children. Like, we go in, like, there's
Mhm,
preschools and there's kind of special schools, and there's a role for nurses there. You could also then work in, like, community centres, like day centres and activation
mhm,
centres, where it's their work, and the person with an ID comes into the centre, and they perform their activities, whatever kind of work activities it is, and some of them have a wage, get paid a wage for that.
mhm,
And then other things, we have recreational kind of facilities that you can get involved in. It's like, it's a person's home that we're going into whenever a person's on placement. You're going in, and we're very privileged and in a
yeah.
unique position to get into that person's, like, home environment. And you're helping them to live in a normal setting in a daily life. So you're helping them with all the skills that they require to go out, like maybe financial skills to go out to manage their money. You're going out to do different recreational activities, like bowling. You get involved in the Special Olympics. So it's not just, if you think, people think of nursing as being the general hospital and
Mhm,
the clinical part. Yes, we do have, and there's parts of intellectual disability where you do have that when people are at the more severe, profound end of the scale. But you have the opposite as well, where you have huge involvement in social and recreational and self-help skills and integration, community integration, bringing people out into the community. So, anybody who's interested in getting involved in any of that really can apply. And we work,
yeah.
with younger children right up to older people. So, it's a career. I think if anybody's in two minds, they definitely should think about it, and maybe
Yeah.
even go to some places and try to get. It's probably harder with COVID now, but get a bit of work experience or something, or talk to us
Yeah.
in the college again.
Yeah.
And we
And
have
I
a
think
lab as
that's
well. I
right.
know
Yeah. I was just about to
Louise
ask you
alluded
about
to
that,
the
about
skills.
the facilities. Yeah.
Yeah, we have a skills lab. Louise, we use the one that's like the hospital, on-site hospital, but we also have one set up like a home for people with an intellectual disability. We have a kitchen, we have a bedroom, we have a bathroom, and we've kind of a living area. And we would do a lot of our skills in that environment so that we would mimic what it's like out on a placement area, because we're trying to move away. We look at the person holistically, and it's not just the medical aspect of the person, because they're not sick. So we're trying to focus on the social, as well as, obviously they can get sick the same as everybody else, and they need help. And so we learn some of the clinical stuff and the medical stuff and some of the general stuff, but we also then have a big focus on our syndromes and different
Mhm.
conditions that people with an ID present with.
I suppose it's highlighting and creating awareness around the program here this evening is the best way for people to become informed. And as you mentioned, if someone was thinking about finding out more information, they can always contact us. We're hoping to have Kieran on with us this evening, but we're having a bit of difficulty with Kieran's line in terms of his connection with us. So I suppose I'm going to ask you some of the questions, maybe if that's okay with you, Stephanie, some of the questions I was was going to pose to Kieran, but I suppose the graduate careers, it's more the, I suppose, the career opportunities. Kieran has had a very positive career post-graduation, 10 years graduated from Letterkenny IT, and has moved along the career ladder in terms of intellectual disability nursing. But what would be, I suppose, the multiple roles that a qualified ID nurse would go into from LYIT?
Well, there's loads of opportunities, really. I suppose, as Louise said there, we would be the same. We try to encourage them to do a wee bit of experience and the placement first, just to get settled in and get used to things. A lot of our students then would go back even to the masters in the college here, and some would go elsewhere further afield to do their masters. And as well as doing the masters, there's also a load of postgrad courses available. There's ones like in pain management and behaviours of concern and sexuality training. There's loads, a huge range of courses out there for them to go on to do postgrad. And some of our students, past students as well, have gone on to do a master's in education. And it's great actually at the minute in the
Yeah,
college. We have some lecturers who are full-time lecturers and part-time lecturers who have been past students of ours. So it's great to see that. And as well, a lot of them, students, when they come in, as I said earlier, they wanted general or they wanted mental health, but then they realise towards the end that they're happy in ID and they like ID and that's what they want to stay
yeah,
in. But you may have one or two who still want to go on to do their general or their pediatrics, and there's career opportunities then because they could go on to do a program in general, a postgrad in general or in pediatrics as well. But we do generally find, Fiona, that what happens is they go off and do those courses, but they still come back to our services and they come back into the intellectual disability services, and they're bringing with them then an extra set of skills and knowledge and like to us, so it's great. Other things then would be like, it's the same as the other nursing disciplines, like traveling. You have the same opportunities to
yeah,
travel all over the world. And again, if you're young and free and single and have no commitments, it's great because they can head off. But you have then the others we have a lot of mature students. So they're, would stay more kind of local and in our services. And there's great progression opportunities,
hmm,
management opportunities as well for our students. And we're out at the minute doing a lot of site visits and audits and that. And it's brilliant when you're out and you see the like of Kieran or the like of other students who are now like in management and are CNM1s or CNM2s and have progressed up the ladder in a
yeah,
relatively short period of time, and it's brilliant for them. So
yeah,
there's plenty of opportunities there, and I'd really encourage people to give it a go and
yeah.
see.
And in terms of class sizes as well, Stephanie, I think the class sizes and the dynamic really helps learning. And there's a question that came in
Mhm.
for you before we started, but it was asking about I've been out of education a while. Is there supports for somebody who's returning to education in terms of the course? A little bit nervous, the person that messaged in about returning to education.
Yeah, there's plenty of supports. I suppose, as you mentioned there, first of all, the class sizes are small, not just in intellectual disability, but in all the three groups. So
Hmm.
that gives students an opportunity to get support from other students in their class because they get to know them well, and we get to know the students well as well, so we can support the students. But as well, there's additional support. There's the curve we have there in the
Hmm.
college, and students can go and attend that. There's different computer classes and different things like that later on if people wanted to get up to date with, technology, because some people who might be out mightn't be up to date with technology. And there's plenty support. You do have a few assessments and assignments and different things to do, but most lecturers will take drafts and help and guide
Yeah,
students. You're not left on your own, and we're aware that if you're coming back to education, that you are frightened, you are scared, you have never written an assignment in ages, and it's you're eased gently into it in first
yeah.
year as well.
Well,
You're,
I
you
often
know,
say to people when we're on the road on behalf of LYT promoting programs, including the nursing programs, you don't come in as the qualified nurse, you leave LYT as the nurse. So, like, you don't. There's no expectation that you are the finished article on arrival on the door on day one. So, for the person that messaged us pre tonight's session, hopefully that allays any fears. So, for now, what we're going to do just quickly is go back to Louise. We seem to have dropped Kieran off the line. and it's such a pity because Kieran came through our program at LYIT, and we're really glad. It would have been great to hear from him tonight. But we're going to have Louise joining us back here now, and we're just going to quickly just touch on some of the part-time postgrad programs in terms of your department, Louise. So we have the MSc in Advanced in Health and Social Care. We also have the MSc in Therapeutic Interventions for Alcohol and Other Drugs. So can we talk a wee bit about these two postgraduate programs, and then we'll talk about the part-time side of things?
Yes, no problem, Fiona. So, just to say that you need to have your level 8 honours degree to actually apply for these, but there is an entry route for a level 7 with RPL. So, typically we have graduates coming on who are in nursing, health and social care, early years. We've actually had a huge influx of people from other allied healthcare professions, including physios and TUSLA. So this is a level 9, it's part-time, it's delivered in a block release program. So for each module, students have 3 full days on a Friday. So just the structure of it, as you've alluded to, there's an embedded certificate, which is in contemporary healthcare management. So they can decide just to do that piece, 30 credits, typically for somebody who's maybe in a management post or a person in charge post in nursing or in allied healthcare. And then they can progress on and do the postgraduate, which is 60 credits. And the novel part of this that we find, as I alluded to at our postgrad, is that they come on board to do the certificate and then they say they'll do the postgraduate. But they're obviously, we would encourage people to keep going and do the full master's and do your dissertation. And then you have a level 9, a significant master's in advanced in health and social care. The structure of our therapeutic interventions for alcohol and other drugs is similar. It's postgraduate stroke master's, 60 to 90 credits. It has one shared module on research, but the other modules are very much specialized around interventions, hidden harm around the influence of alcohol on the child and the family, and very much evidence-based. We have expert speakers who deliver on that, and it's actually delivered in partnership with our Donegal Alcohol Forum partners here in Donegal. So very specialised, and we would have in the past have typically somebody who's psychiatric or working in the area of mental health, counselling, but we also had career teachers or youth workers or community people who are really interested in this area, and the specialist modules and the guest speakers make it really, really popular and very interesting. So there are two obvious master's programs. We've also got a consortium approved course which is also accredited by the Nursing and Midwifery Board. It's a master's in professional nursing, and we're embarking on hopefully delivering that, subject to getting sufficient numbers, in autumn or September of 2022. So that'll be a collaborative delivery with the other institutes of technologies, and it will be predominantly online. So it's an exciting opportunity for somebody who wants to embark in the area of clinical nurse specialism or indeed advanced nurse practice. So that is obviously a career pathway that we've already identified for all of our disciplines, both in general, mental health and in intellectual disability.
That's fantastic. And just in terms of the department, Louise, are there any plans or future developments coming around the corner in terms of the Department of Nursing?
Yeah, well, I suppose the most important thing to say is we don't just create programs for the sake of it. We respond to service needs and demands and what our graduates want. So we survey and we really listen and hone in on the feedback of our graduates. So as Stephanie has alluded to, intellectual disability, some of our graduates in mental health and in intellectual disability would like to go on and do a general nursing course. So we're looking at doing a postgraduate in general nursing, and obviously that we envisage be in collaboration with the other institutes of technologies. So that's certainly an area that we're looking at. There's also an enhanced interest around the area of CBT, cognitive behaviour therapy. So we're hoping to offer some standalone or indeed a postgraduate area or a master's in that area. Clinical supervision, again, very contemporary, very relevant, supporting each other as peers in the profession of nursing. But as we've mentioned about ATU, the Atlantic Technological, there'll obviously be joined up thinking and
Yeah.
partnerships in the delivery of creating new programs, and that synergy is going to be very important. So we're obviously very responsive, as I said, to our HSC, our partners in courses that we develop, so that they are actually delivering programs that are
Yeah.
useful, relevant, and enhance the skills. We also have 2 other standalone or special purpose awards in emergency nursing and in acute medicine. So they're typically for people who are working in the acute general area and want to upskill in those areas, or indeed go on and do postgraduate courses. So,
Yeah.
lots happening, and again, very open to service needs and demands with regards to developing courses with the HSC and other partners.
But that's amazing. I suppose, Louise, in terms of the course delivery, is based on course need. And to hear programs like the conversion course coming on track into general, I know it's a question it's that comes up often. I want to bring Stephanie back online again. So, Kieran, we're going to hope to get Kieran for one of the Instagram lives now, because I think to highlight intellectual disability nursing with a graduate and someone who's come through that program, as you rightly point out, Stephanie, not enough people know what ID nursing really is truly about. And we're going to get Kieran back on with us hopefully next week for the first of our Instagram live sessions. So we'll be touching base with him and really going into more detail about the graduate story in terms of the program. But a question that's come in, and I'm going to pose this question to you, Stephanie. It's not too heavy, so don't worry. But the placements for intellectual disability nursing, are they full time too? And do students have to get them, or do you help in terms of the department?
No, as Louise said earlier, we have a placement coordinator, so the placements are all sorted for you, so you don't have to worry about that. And in terms of the placement, they're located throughout the locality, the vicinity of Donegal, the county. So we have sites in Letterkenny, we have sites in Ballybofey, we have sites in the Inishowen area, and Dunlow, Donegal Town, Ballyshannon. So really all Falcara, all over the county, we have sites. And on the programme, the student has to do so many hours in different placement areas. So they have to do so many hours working with the child, so many hours working with the adult, so many hours in the older person, and so many hours with people with behaviours of concern as well. So that's all mapped out for you from by the allocations officer. So you get your placement and you go on your placement then.
Okay. A question's come in, Louise, about studying nursing in Northern Ireland, studying versus studying nursing in the Republic of Ireland. Why is it 3 years in Northern Ireland and 4 years in the Republic of Ireland?
Yeah, very good question. And I
Yeah.
suppose that's why we were boasting about the internship. Quite a number of years ago, there was a radical review of the delivery of programs. So the structure of the Republic of Ireland degree program is that it's 4 years, and that the internship, that paid 8 months of an internship, is I suppose 3/4 of your 4th year. So it's
Mhm.
just because of a different structure. Predominantly that it would have been traditionally a 3 year, but since the restructuring, it indicated that really that, affording a student to have an internship actually at the end of the 4 years produces a really fit for purpose graduates to hit the ground running. Now, not to say that there's anything wrong with doing your 3 year course
No.
in Northern Ireland, whether it's Queen's or UU. It's just a different structure, and it's the one that the Republic of Ireland has actually adopted across the 14 higher education
Mhm.
institutions. So it's the same structure throughout Ireland for any of the colleges that deliver undergraduate nursing.
Okay. And the number of PLC and mature student places in ID nursing,
The
could
same, yeah, it's actually the same. It's across the board the same. So there are 5 mature, 3 further education, 1 here and 1 there. That's the same for general nursing,
wow.
psychiatric nursing, stroke mental health, and intellectual disability. Just to note also, Fiona, I think we alluded to the places. I think Stephanie certainly said that the ID program and the cohort is smaller. The prospectus will note that there's 20 places for intellectual disability, but in the last 2 years, because of the pandemic, we've actually, our Donegal ID services increased the places by 2. So there's actually 22 for intellectual disability. There's 32 in psychiatry, stroke mental health. 16, as I said, go to Donegal, 16 go to Sligo. And whilst the prospectus says 31 in general nursing, in the last 2 consecutive years, our general Letterkenny University Hospital Partners Director of Nursing there has accepted 35. So we've actually an additional 4 places in the last 2 years. So that's good, because it
Yeah.
increases the
The
potential of somebody
chances,
actually. Yeah,
yeah, of
absolutely.
securing a place. Well, we were late getting started, but we definitely covered a lot. And such a pity that we couldn't have Kieran on with us this evening. But I want to thank you, Louise, Dr. Louise McBride, and also yourself, Stephanie Bonner, for joining us. And as I said, watch out for our social media pages, where we'll be profiling Kieran at some point now over the next week to 2 weeks, with our Instagram live session starting with Victoria Wilson as well. So to find out more detail of what it really is like in terms of being a student and to study ID nursing at LYIT, tune in to the Instagram live. So thanks so much for joining us, and good night. And we look forward to joining, connecting with you all again next Thursday night for the next of our live sessions.